But I wanted to have a larger effect on healthcare. So I started the Center for Mind Body Medicine. And the idea was to bring, as you said in the beginning, to bring this approach of self awareness, self care, and mutual support to make that central to all healthcare, to the training of health professionals, and to the education of our children. Not exactly a modest goal, but I figured, okay, I'm why not do whatever I could? And so 34 years ago, I started the Center for Mind Body Medicine with no money, no paid staff, 25 volunteers, doctors, nurses, teachers, mental health professionals, and also a professional gambler, which I took as a good omen. He was very interested in our work. So we've been going, and just briefly, initially our work was we developed a training program in mind body medicine. A little while later, a training program in nutrition. A little while later, a training program to help people explicitly work with cancer patients. But in the beginning, our focus was primarily on training clinicians, training physicians and mental health professionals and nurses. When I began to see how well that program was going, initially in Washington, D.C., where I live, then nationally in the U.S., training people, we had a major focus on training medical school faculty, but they were not the only one. But it was going well, and I thought, well, let's see, can this same approach work in some of the most troubled places on the planet? So I began to go to some of those places and bring this approach there. And lo and behold, it did work. We were able to train many, many people in a number of places, which we can talk about. And they, in turn, were able to use this work, use this model that I and my colleagues created with thousands and thousands of people in many places around the world, as well as here in the United States.